Hi everyone, my name's Kerry and I'm the National Development Manager for Alström Syndrome UK. As many of you know, I'm also the mum to a young adult diagnosed with Alström Syndrome. The pandemic has been an incredibly challenging time, but I'm really pleased that it's also provided an opportunity for the global Alström community to come together for these 2 days. Today I'm going to talk to you about how we've introduced telemedicine clinics in response to the pandemic and the challenges and opportunities that this has created. I'm speaking to you as a representative of Alström Syndrome UK, but I'm also going to be talking about our own personal experience of a telemedicine clinic. So just a brief introduction to Alström Syndrome. So as you know, Alström Syndrome is an ultra-rare and complex genetic condition. ASUK is a national charity and we have 87 patients on our database. We're very lucky in the UK to have highly specialised multidisciplinary clinics. And as a charity, we have a contract with NHS England to work in partnership with Birmingham Women and Children's Hospital and Queen Elizabeth Hospital in Birmingham to deliver the Alström service. We have a family support service at ASUK and we have dedicated family support workers to support families during clinics, but at other times too, where we offer home visits, support with schools, benefits, assessments. Obviously we're not able to do face-to-face visits at the minute, but we hope to get back to that soon. And we're really missing that face-to-face contact that we have with families at the minute. We also manage a project called Breaking Down Barriers, and we facilitate a network of patient organisations, support groups and community networks to develop supportive and inclusive services with a particular emphasis on improving engagement with people from ethnic minority communities. So a brief introduction to clinics. So for our children and young people, we have 4 clinics a year held at Birmingham Women and Children's Hospital, and we have 1 outreach clinic at St James's Hospital in Leeds for families living in the north of England. We have 5 adult clinics at the Queen Elizabeth Hospital in Birmingham, and then we have 1 transfer clinic that's supported by our transition coordinator and by both the children and young people's team and the adult team as well. And that supports young people who are moving from paediatric services through to adult services. So generally, prior to the pandemic, our highly specialised service for children and young people, as I say, is held at Birmingham Women and Children's Hospital. Families would come to Birmingham on a Sunday evening, stay overnight in a hotel, and then attend a full day of appointments on the Monday. They would see a range of different professionals involved. So the clinic is led by Professor Tim Barrett. And while they're at Birmingham, young people will also see a cardiologist, a dietitian, a physiotherapist, a diabetes nurse, clinic coordinator, geneticist, ophthalmologist, audiologist, research team, transition coordinator. So there are lots of people involved in that clinic. Young people will also have a range of different tests. So they'll have their height, their weight, their blood pressure. They'll see a physiotherapist where they'll have an assessment, do some stretches. They'll also have blood tests. They'll have heart checks. So they'll have an ECG. They'll have an echocardiogram. And there is an opportunity to have an eye test and a hearing test as well. So a range of different people and lots of different tests within 1 full day. As many of you know, Alström syndrome is a progressive condition, so there are a few more specialists involved and a few more tests when young people move over to the adult service. So the adult service is led by Dr. Tarek Highwatt, who's a metabolic specialist, and there are additional tests that they will do at the adult clinic, such as a cardiac MRI, liver MRI, CT angiogram, lung function tests. But again, they'll see all of the professionals that they would usually see at the children's hospital as well. But the adult clinics are run over 2 days. So families will come to Birmingham on a Tuesday evening. They'll have a meeting with Tarek and his team on Tuesday evening, and then they'll have a range of different tests on the Wednesday, and then their consultations will happen on the Thursday, and they'll get their test results on Thursday before they leave. So then in March, COVID struck. So all of our highly specialised clinics were postponed, and many of the local hospital appointments were cancelled and postponed, and some were changed to telephone consultations. Alström patients did fall into the extremely vulnerable category. So as a charity, we worked incredibly hard to make sure we made contact with all of patients on our database to make sure that they had access to the information that they needed to know how to protect themselves during this incredibly challenging time. When we spoke to our clinicians, we were looking at how we could respond to the needs of families to offer that reassurance. And we were able to introduce telemedicine clinics so that our patients could at least have some contact with their clinicians. They could ask their questions and hopefully help to alleviate any of the concerns and anxieties that people were experiencing. And also for people to feel reassured that they were getting the advice from the lead clinicians of the Alström service, who they know extremely well. Because even though patients were getting messages from the government, it was very difficult to interpret and understand that, and people needed the reassurance from the clinicians that they were familiar with. So I'm going to talk to you about different perspectives really in terms of telemedicine clinics. I'll start off by talking about the clinician's perspective. And in some ways, it was quite convenient to do a telemedicine clinic. Obviously, the appointments don't last as long as face-to-face appointments can last sometimes. You know, it's able to keep clinics on track and stay, you know, keep to appointment times. One of the big advantages of telemedicine clinics is that we can also include local healthcare professionals as well. So it was a real joined up approach, and even, you know, we've had a couple of new referrals this year. So the local teams who made those referrals were able to take part in those telemedicine clinics as well, which hopefully offered some reassurance to families who had just received a diagnosis of Alström syndrome, and it helped with the introduction to the multidisciplinary team. There were challenges in that sometimes children and young people didn't always take part in the telemedicine clinics, and they were being led by parents. A lot of the tests that are usually done weren't able to be done locally, so doctors didn't have the results that they needed to be able to make decisions on any changes to the management of Alström syndrome for patients. It can be quite resource intensive, lots of coordination needed for telemedicine clinics, and very difficult for clinicians to establish relationships with families over the computer. Really, it's very challenging to do that, opposed to what it's usually like face to face, and also getting used to the different software programs and just supporting patients in a very different way. What I will say is we're extremely grateful for the time and commitment that our clinicians have shown to be able to switch to telemedicine and to support our patients in the way that they have been able to do. I've had personal experience of that as a parent of a young man with Alström syndrome. So my son is 19 years old, and we're going through an incredibly challenging time. Although my son is aware of the risk of COVID-19 and the, I suppose, the risks associated with Alström syndrome in general, he's at a time in his life now where he is making more decisions himself, and those decisions aren't necessarily having a positive impact on his health. One of my son's famous sayings is, "I'm here for a good time, not a long time." So it's, in some ways, I admire the fact that he's going out there and living his life. It's also very difficult as mum when I see that some of the choices he's making aren't necessarily having a positive impact on his health. And that's even more difficult when we are not visiting hospital and not having all of the tests that we'd normally have. So, you know, we have been very worried about COVID, but I think I've been very lucky that we have got the close working relationship with the teams in Birmingham, and we've been able to make sense of the government guidance and the things that we need to do to be able to protect ourselves. And the fact that we've done a lot of work with Tarek and his team, so I've felt confident that we're doing all that we can to protect ourselves during this challenging time. So we were able to get local blood tests done before our appointment, and we were supported by the team. My son found it very difficult to access a telemedicine clinic due to dual sensory loss. So for us both to be able to take part in that clinic, and to have all of the different professionals involved in that call, it was very difficult for my son to be able to follow all of those conversations. And because some of his results weren't necessarily positive results for him from his blood test. There was, we were trying to manage a range of emotions, which is very difficult when you're talking to people on screen. But I think we also were aware that it was very challenging for the clinicians as well. If we had been there face to face, there would have been a lot more time to support us through, getting the results and looking at talking through some of the challenges that we're experiencing and the changes we may need to make. It was very frustrating for them as well as us to have limited opportunities to be able to offer that support. But what I will say is, we are so thankful that clinicians were able to adapt and to offer us that telemedicine service, because despite it being quite a challenging process for us as a family, I can really see the changes that my son's made since then, as he sat back and thought about what the clinicians said to him and the things that he needs to do to improve his health. From a patient organisation perspective, we've always been involved in developing the clinic list and taking part in pre-clinic meetings and supporting our patients through that whole process. So we've done the same for telemedicine clinics. So we've been looking at what accessibility needs patients have got, whether they need interpreters, whether they need support to access the technology. We were able to help people prepare in terms of providing an information sheet that encouraged people to do their height and weight and to keep a food diary. We gave tips about making note of any changes in medication and making a note of any questions that they might have, so that they were fully prepared for their telemedicine appointment. And we were also able to attend those telemedicine appointments as well to support a patient if they wanted us to. So some things worked well, some things were challenging. So the things that worked well really is that families really did feel that it was beneficial as an interim measure. They generally felt reassured to see their clinicians, and the majority of families didn't want to come to the hospital. They didn't want their face-to-face appointment. So it was really good that they could access, although telemedicine clinics weren't perfect, it was much better than the risks they would have had to put themselves in to visit a hospital during the height of the pandemic. And they were also able to receive advice about healthy eating and staying active. And this was incredibly challenging while people were shielding in the UK, as I'm sure it was elsewhere. So people didn't have access to the kind of exercise that they'd usually have. They may not necessarily have been eating as healthy as they normally would be. So it was very good to be able to get that advice on the little things that people could do to make a difference. Some of the challenges were that there was some connection and technology issues, and we've been really aware and conscious that we didn't want people to be excluded from telemedicine, and that was challenging for some people where they may not speak English as a first language, or they may not have access to the technology. So we did what we could as a family support team to support patients to access the technology and to include interpreters if need be for those clinics. Not all families did have access to equipment such as weighing scales, or are able to measure themselves or their children and young people. There was also limited opportunities for one-to-one conversations. We were able to offer breakout rooms, or sometimes clinicians would phone patients to have a one-to-one conversation, particularly with psychologists or maybe the dietitian. But it can be very challenging, particularly for the families who were new to the Alström service, to be faced with so many different professionals all at once. Some found it incredibly helpful, some found it a little daunting. And both hospitals are using different platforms, so we had to get used to the different technology that's being used. As we do with every clinic, ASUK carry out a thorough evaluation after every clinic to identify ways that we continually improve the service. So here's some of the feedback that we've had following the telemedicine clinics. So one parent said, "I think the service was excellent. My first telemedicine appointment went well for my now 1-year-old son. It was wonderful to see a group of professionals together giving me as much knowledge and support in regards to Alström syndrome." One adult patient said, "Thank you, clinic was good." Sorry, this is a parent. "Thank you, clinic was good. Blood sugars are stable and the exercise and diet is really paying off. Dr. Tarek was happy with the results. Thanks to all clinic and to ASUK staff." So we were really pleased that Dad and the young person felt really reassured by having their telemedicine clinic. One adult patient did say, be clearer about what information is needed. Set a timeline before the clinic. For instance, blood tests need to be done at least 3 weeks before the clinic. Arranging local blood tests was extremely challenging. Some GP practices were offering blood tests, some completely refused to do any blood or any routine blood tests. So it was very difficult for some families to get access to some of the tests that they needed. And hopefully that is something that we would be able to improve in future for as long as we need to stay with telemedicine clinics. We also took part in a consultation that was organised by NHS England, and this was to look at how families were impacted by COVID-19, what all the different services had done to respond to that, and whether there were any opportunities that could be adopted for future clinics and you know that may be able to stay around. So this was chaired by, the meeting that we had was chaired by NHS England highly specialised service commissioners. And it was the purpose of that was to engage with young people, adults, carers and healthcare providers. And the aim was to know patient, family and carer views about their experience of a number of outpatient-based rare disease clinic care since the start of lockdown in March. So it wasn't just the Alström service that was included in this consultation. There were some other rare disease services that were involved as well. And I think what was clear is that it was a very mixed response, which highlighted some of the challenges and opportunities. Challenges were in terms of accessibility, culture, language barriers, safeguarding issues, assessments, inequity in access to local tests, and digital exclusion. Some of the opportunities were clinicians felt it was very good sometimes to see families in their own home environment. Families didn't have to travel to Birmingham. Some families do travel very long distances to access the service. There was an opportunity to engage with local healthcare providers, and they were able to identify some immediate issues and to offer some reassurance to families. I think what's been very clear within AS UK is that there was no one size fits all. There's some families did like the model of telemedicine clinic, particularly if their health was very stable. Whereas for some families, they clearly missed the face-to-face contact. But in response to the pandemic, it is a very positive interim measure. So as a positive outcome to this, NHS England have now agreed to provide some equipment so that people can monitor their health at home, which is fabulous. But also there's still lots more work needs to be done to help coordinate all that and to make sure that families feel reassured and understand how to use the equipment, and then obviously just be able to discuss those results with their clinicians. So the findings from that consultation was presented to our local rare diseases advisory group, and it's something that will remain under review. Our hope moving forward as a charity is, we would not want to replace face-to-face clinics. I think that's something that we've always valued in the UK. And as I said at the start, we're aware that there are so many people involved in this conference that don't have access to clinics, and we know how lucky we are for that. But, as an interim measure, telemedicine clinics seems to be working fairly well, and we're forever grateful to our clinicians to be able to offer that service to us. So that's it from me. My contact details are on screen, and they're available on our website. If you have any questions about telemedicine clinics or any further feedback that any of our families want to share with us, we'd love to hear it. So thank you for listening, and I look forward to answering your questions.